It was a great week last week for single-payer healthcare. A room full of Republicans at a GOP town hall cheered it. Damn. So we covered that story. That story brought a smile to my face because it showed me that when you frame liberal policy issues and goals properly, everybody agrees with them. I mean, if you say, I want to do a government takeover of healthcare, they go, oh, no. But if you say, as this woman did in the clip, oh, we should expand Medicaid or Medicare and cover everybody, they go, yeah, that's a good idea. That's like a great idea. So it's all in the framing. You know, it's like the poll that found the Affordable Care Act is popular, Obamacare is not popular. It's the same thing. The Affordable Care Act sounds legit, so we'll go with that one. So it's all in the framing, but this woman got up there from a Christian perspective, said, hey, you know, we need to cover everybody because as a Christian, that's what we should do, and we could do it by expanding Medicaid or Medicare. And everybody liked it. Now, we also learned last week that California proposed a single-payer bill for their state. I cannot tell you how much I support that. Because here's the thing. So I used to be very rigid on the idea of, no, we need a federal single-payer healthcare system, and that's it. But one of the common rebuttals that I got was, okay, man, but look, states' rights and conservatives are concerned about they want that power close to the chest. They want it in their state. And so for a while, I would just say they're just wrong. We need to do a federal single-payer system. And I think, mostly prefer that. But there is a compromise that I think is an intelligent compromise. And the intelligent compromise is, okay, you don't want a federal single-payer system? Fine. How about a federally mandated state-by-state single-payer system? So in other words, federal law is each state has to set up their own single-payer system in their own state. And California is taking initiative on that. They're saying, there is no federal law that says that, by the way, to be clear. But they're saying, on our own volition, we're going to go ahead and create a single-payer system at the state level. And hopefully this falls, and then a bunch of other states do it too. But it'll be super hard to do it on an individual basis. Each state after each state is really hard because you're going to get so much pressure from big pharma and health insurance companies and every company in the medical field because they know that they're not going to make as much profit if California goes in a single payer direction. So they will flood money to try to defeat it like you've never seen before. I can guarantee that. And that's what happened in a few other states already who tried to do this or similar initiatives. So it'll be hard, but if any state can do it, it's California because they're so large. But I would meet the conservatives in the middle and say, you don't want to do a single payer federally, even though it's the best system, fine. State by state mandated single payer. So Kentucky needs their own single payer system. Alabama needs their own single payer system. And there's got to be some strong enforcement mechanism to make it so that they do it. So California proposed that. Great idea. I'm with them 100%. Couldn't tell you how much I agree and how much I love it. So that's another good piece of news for single payer. And now we have this from Pew Research. Look at this poll. More Americans say federal government has responsibility to ensure health care. Look at that. So the numbers used to be, it was high. It was 64% up until about 2008, 2009, and then it dropped. But now there's been another reversal. 60% of the American people say yes, it's the government's responsibility to provide health coverage. So in other words, 60% of the American people say, let's catch up to every other modern nation and have some version of a single-payer system. They're right. They're right. And I think people, because of the internet and because of the free flow and availability of information, people are now learning how much they're getting screwed over. Millennials have a lot to do this because millennials are hyper-educated. So we know what's going on. We're paying attention. We figure it all out. Oh, look at what Europe has. Oh, look at how these people do it. Look at how those people do it. Oh, shit, we're way behind. Why are we behind? Let's catch up on those things. So these ideas are becoming way more popular, and they should be, because they make sense. So it's been a great week for single payer. I hope that number only climbs in popularity. We get like 85% of people saying, yeah, we need a single payer system. Yeah, it's the government's responsibility to ensure healthcare. I hope that happens, and I hope California succeeds, and I hope we go further and other states do the same thing. And eventually, at the federal level, we get some kind of a single payer system.